Welcome back to Wake Up Charlotte Weekend. May is Mental Health Awareness Month, and it comes at a time when the CDC says suicide is one of the leading causes of death in our country. We want to warn people this conversation could be triggering to some. Today, joining us for an open conversation on mental health awareness is Miss Fonda Bryant, a local mental health advocate and nonprofit founder who's dedicated her life to helping others. Fonda, thank you so much for joining us.
Thank you for having me. I really appreciate it.
Now, I know this story is very personal for you, so I want you to just start by talking to us about your story.
Well, 28 years ago on Valentine's Day, a day of love, giving flowers and cards, I was planning my suicide. I was in so much pain. No one knew because it's such a shame that comes with mental health, especially in our culture. And so I was in a lot of pain. I was struggling. My brain was telling me, you're worthless, kill yourself. No one's gonna care. Your son would be better off with someone else. But before I did that, I had this plan. I reached out to a hero, my Aunt Kelly, my Aunt Spanky. And I called her and told her she could have my shoes, a prized possession that I was wanting her to have. And she called me back. She said, are you gonna kill yourself? And I said, yes. And she went into action like a superhero. That's what I will always think of her as, a superhero. She went into superhero mode. She had me involuntarily committed. And as bad as that day was, she saved my life. So when I went through that, I realized that there are other people struggling like me, especially in our culture, and I wanted to turn around and help. So I've been an advocate for over 20-something years, but I didn't become a strong advocate until I started getting educated. I joined NAMI, the National Alliance on Mental Illness here in Charlotte. I just stepped down off the board of NAMI North Carolina after serving 6 years, and I volunteer with other organizations to bring awareness because education is really the key in stopping suicide, but also getting rid of the negative stigma that comes with having a mental health condition. And that's one of the biggest reasons people don't go get help is because of the stigma. There's not a lot of empathy, compassion, and kindness for people that have mental health issues, and we need to change that.
Now, there are going to be people who are watching this that may be experiencing depression. And I know when we talk about suicide, it's sort of a scale where it goes from considering to planning to actually deciding to take your own life. But wherever you are in that scale, what are some warning signs to look for? Maybe some advice for people who are maybe in a low place, as well as strategies for people who want to be a hand of support.
Well, I tell people all the time, I wear it on my wristband, and it's my 3 favorite words, my favorite phrase, you're not alone. When you're struggling with the mental health condition, it's over 40 million Americans that have anxiety, over 17 million of us that deal with depression and the combination of depression and anxiety. And when you're struggling, you feel like you're by yourself, even though you know you're not. So I always let everybody know you're not alone. There's help out there. You can call. You can, if you don't, first off, even dial 988 or 800-273-8255. Reach out to someone, talk to someone, and let them know how you're feeling, because that's what I did not do. I didn't feel like no one would care and no one would understand. And the biggest factor too is we don't want to be judged. You already feel worthless, you already feel hopeless. So I tell anybody that's listening to not feel like you're alone. There's help out there. Reach out to a friend. And I tell our friends and family members, please don't judge us, because a mental health condition is real. It is a true physical condition. And the last thing we need when we're struggling is someone who's not going to understand, who's not going to help us. So please do not feel ashamed to reach out and make that first call, because I promise you, if you get the help you need, you can get better, you can recover, and you can live a good life. Because look at me, 28 years ago, I was on that journey of not being here, and now here I am. But I have to put in the work every single day because I have a disease of the brain that is never going away. So people can't say, well, you know what, if you just take your pill, or if you just go to therapy. No, you have to find those good coping skills. As I said, I have an imaginary mental health toolbox where I put good coping skills in it. So on those days when depression and anxiety are kicking my butt, I reach in my imaginary mental health toolbox and I might pull out working out, which I do 3 to 4 times a week, coloring. So it's things that we can do to help ourselves every day to stay on the path of wellness.
Fonda Bryant, thank you so much for sharing your story, for being vulnerable. I'm certain that it has helped a lot of people out there. You can catch Ms. Bryant at 11 o'clock on Flashpoint. She'll be talking more about a bill going through the General Assembly that is working to help people who are experiencing a mental health crisis through suicide prevention signage. So we hope you'll check that out as well. Also, if you are experiencing a mental health emergency, you can call 988. She mentioned that number to you, and we have more information on our website.